Welcome, Stephen, to the ValYou podcast.
Hey,
Thanks for coming on.
Appreciate it.
Do you want to give us your background a little bit or what you're an expert in?
I don't know if I would go as far as to say I'm an expert, but I have been a registered nurse in the same hospital for about the past 5 years. Currently work as well as a charge nurse within that department. It's a smaller community hospital, but it serves a major medical center, and we see anything and everything.
What do you mean by a major medical center for those that are listening and viewing?
So I think like major medical center being basically the nucleus of where other pieces of hospital systems will feed into. And so if you work for a major hospital system, you're going to likely have one center that will have all of your specialists in it, a place that will be able to primarily take the most emergent patients. So your major trauma cases, your like sickest of the sick patients, those will be sent to the medical center once they've been stabilized, generally at another feeder hospital, such as a community hospital. And so our purpose is to serve whatever comes into our doors, to take care of it, and find a reasonable place to basically package and ship a patient safely.
And you primarily work in the emergency room, right?
Yeah, so I do. And I also work occasionally at a small rural hospital as well, but also in the emergency department.
Okay.
So
you see everything.
Yeah. I mean, like anything that would come in to be seen for an emergency situation, which, can be anything.
A little bit of everything. There you go.
Runny nose to broken arm to bleeding out.
Exactly.
Giving birth, everything.
And I'm glad you brought up the runny nose too, because there are plenty of those. Plenty of people who just come in for those very very minor things.
Yeah.
Yes.
People think that the ER is like probably this glamorous place of just traumas left and right. And
Yeah.
I've heard that a lot of the time it's just like
take some NyQuil,
like
go
half
home.
and half mundane and then like interesting.
Right. And it seems to come in spurts. It's
Yeah.
like at times it will very much seem like an ER is featured on like a major TV show or movie. And then there are other times where you're taking care of ankle sprains and stubbed toes and you're waiting for a patient to come in.
Yeah.
Although that hasn't been the case for the past year and a half or so.
Yeah,
there has been very little waiting.
Yeah.
Mm-hmm.
Yeah.
It's a great point. We wanted to touch on as well, because obviously the past year and a half has contributed some really unique circumstances for the world at large. But I would imagine for
pandemic.
you,
I don't know.
like
Did
that.
you guys hear about that? I don't know.
Crazy word they're throwing
Yeah.
out.
I know, but I would imagine for you specifically as a nurse in the ER room, you have some unique experiences and some unique things that you've learned and seen in the past year and a half. Can you speak to that a little bit?
Yeah, for sure. It's funny. Like I look back on the warnings that we had prior to the pandemic itself. And so if you were to put yourself into any healthcare provider's shoes, you would have to go back to really the end of 2019 when we knew that there was a thing that was going on halfway around the world. We didn't know much of it. It was just something that we knew was called coronavirus. And I think just like the general public, healthcare workers too were thinking, okay, it's a coronavirus. We know what coronaviruses do. They make people get colds. For somebody who might be immunocompromised, it might make them a little bit more sick. But this one was different. And it was different based on the information that we were receiving. It was causing low respiratory infections, which leads to pneumonia. It was causing people to get really hypoxic. And it wasn't just attacking people who had compromised immunity. It was attacking people who were otherwise healthy, sometimes young, sometimes old, but there wasn't really a pattern to it. And so as that started to kind of be in the background, we had a little bit of time to prepare for it, but really not much. Like our preparation was asking patients if they had recently traveled to a very specific province in China. And the answer was always no. We really didn't see what we know to be as COVID initially for the first several months of 2000. And then we got a case. I don't know if you remember that, but we did get a case that was brought to Utah specifically from somebody that was diagnosed, I think, in like California or Florida or someplace. And they sent them to Utah. I don't know why, but they did.
They sent them from the hospital to Utah?
Yeah, because Utah was willing to study COVID. And like this guy was like put away in some isolation area, and he was fine.
Poor guy.
And they were like
Science
trying to study it.
experiment.
I know.
Yeah,
Here's your
and
bubble.
they were watching him as like some lab rat, and I don't know
Wow.
what happened to that guy, but it was just like some dude
Interesting.
who happened to have COVID. He was like one of the very first,
Dang.
and then you had a few cases that just kind of popped up here and there, and I honestly think that like if you were to time it all, we had this earthquake that hit in Utah.
Yeah, I remember that. That
We had
was
the
wild.
basketball season that was canceled, and then the next day it's like we woke up and COVID existed.
Yeah.
And
Yeah.
that's how it was for me as a healthcare worker. I'm sure it was very similar for you guys as well.
So it was that quick. It was like overnight. You're like, wow, our hospital's full of COVID cases.
it wasn't that way though. Like it wasn't full of cases. It was full of preparation.
Okay.
So what we did is we went to start to look at all of our different algorithms. We started to analyze what we need to do if a patient comes in with specific symptoms. So like if they have a cough, if they have a fever, if they have chills, if they are really weak. But ironically, this is also at a time period where we were just ending our respiratory season. So this is like March, April 2000. And that's still when you see RSV, that's still when you see flu, that's still when you see plenty of older people who don't have as strong of an immune system come into the hospital for respiratory things.
Yeah.
And so it's like, we're literally going to suddenly have to screen half our population that's coming into the ER anyway and say, do we need to test you for COVID? But we didn't have the tests. We had no way of testing for the first several weeks.
Wow. I didn't even think about that.
We were told to contact
Forgot
infectious
about that.
disease
Yeah.
and explain to these infectious disease doctors, hey, we got someone who needs to be tested for COVID. And they're just like,
Great.
it's great.
Cool, yeah.
We can't really do
Can't
anything
help
about it.
Wow.
And so it was around that time too that like a true hard shutdown happened.
Yeah.
And the hospital decided that they were going to come up with all sorts of protocol to make sure it was a safe environment. They canceled elective surgeries. And the ER went through a time period where it was trying to identify ways to protect other patients and protect staff. And
From COVID.
yeah, from COVID. And also, like, are we expecting masses of people coming in who are going to
Yeah.
be tested? The majority of people who have COVID also aren't likely to be that sick. So what do we do for those people? How do we make sure that they don't spread their illness to somebody who could potentially not do really well with COVID?
yeah.
So there's like a lot of like figuring out.
Well, these are the same questions that I remember having. Like maybe not that detailed.
Yeah.
But the public was asking the same questions.
Just what
to
do we
themselves.
do?
That surprised me because I thought the hospital knew something, like some underground thing that the public wasn't. But I guess not. They were just kind of.
I think it depends on what type of threat it is. Like, again, we're talking about something that was called coronavirus. This is not Ebola. This is not Zika, which could have become pandemic as well. It's not SARS-1, which affected parts of Canada and Asia back like around the turn of the millennium. And so we didn't really know what to make of this yet because it was something so new and not well understood. All we knew is that it was contagious and it led to an atypical type of pneumonia, and it seemed to actually kill people.
Yeah.
And so we were concerned. And I think the medical community at large was very concerned because they're thinking, how in the world do we continue to keep our doors open while providing adequate health care and access to people, yet protecting our own staff and making sure that they have proper PPE, which, by the way, PPE wasn't a term that was used by just a general member of the public prior to COVID. Like,
Yeah.
everyone knows what PPE is now, but
Yeah.
no one knew what it was prior to it.
That's
Yeah.
crazy.
And so it's just like an unfolding of these events. And to be honest, Ty, we weren't busy. We weren't busy for several months into the pandemic. It really wasn't until
Several months, like 6
I mean,
months.
we had the shutdown from like March. We just didn't really start seeing COVID come in and truly threaten at least our healthcare setup at that hospital until I would say mid-fall,
Wow.
probably 2000.
What?
Do you think
Yeah.
that was because people were so terrified that like the spreading rate was just a lot slower
Right.
than it got to, say, in fall of 2020 when people were like, okay, like I kind of want to go back to life. Colleges were allowing students to come back. Do you think that contributed?
Totally. I think it did. I think
Steven,
that
really quick, can you put the microphone just a little bit?
Yeah,
just a little
for
bit
sure.
Yeah, perfect.
Okay.
There you go.
I think that there's definitely some balance to that. I think that people at the beginning were trying to figure out what this meant. So there were plenty of people who were scared. Because all you had to do is turn on the news and you see these long lines and you see ICUs one after another at some place in the world. Like Italy, I think was hit really hard. France was hit really hard. And then New York City was hit really hard. And then you watch all these clips and you're like, what is going on? This is really bizarre. This is just affecting like major cities and travel areas. They had like those cruise ships that were docked. And like, apparently like if you travel on a cruise ship, you're going to get COVID. Like that was a thing. And so, I think people were fearful potentially. And I think other people just realized, well, I'm not going anywhere. Like they weren't going about and doing their normal routine. So they weren't actually getting sick because they weren't seeing other people. So I'm not saying just sick from COVID. I'm just saying like sick from spreading any illness for that matter.
The flu didn't just go away when COVID hit. Like
you wouldn't think they did, but it kind of did, to be honest, because everything shut down. In fact, that's one of the more interesting things because in the year 2020 going into 2021, detectable cases of the flu, detectable cases of RSV were at 0 for our entire hospital system. And I'm not talking about my community hospital. I'm talking about the entire hospital system that I work for. They were testing left and right for it. They weren't detecting it. So
that's crazy.
It goes to show
that's
like
wild.
COVID was still spreading. The others weren't. Is COVID that much more contagious, or were we like really effective at being able to control flu and RSV for some reason? We don't have the answer, but it will be like something great to study later on.
Interesting.
When this might be an easier question to answer for some people than others. I didn't really get affected by COVID. I didn't go to the hospital or anything like that. But the mass hysteria that we were seeing on the news and television, it seemed like the world was falling apart. Were you seeing that reflected in the hospitals?
Yeah. At any point?
Especially at the
any point. I'd say yes, actually. Like it's hard though for me to speak from other perspectives other than the ER. And so I'm just going to keep my comments directed towards the area of medicine that I work. What I saw starting, I would say, again, mid-fall 2020. I think I said 2000 at one point. I meant 2020.
We got you. It's okay.
But
we'll never forget that year.
Oh, geez. I've already lost at this. I think in mid-fall 2020, especially turning into that December and January, really started to pick up. And it was honestly a really frightening time. We didn't have any way to effectively booster someone's immunity for COVID itself. So we were still understanding how to treat it. There were no vaccinations that were available. It was the Wild West as far as if you're going to get COVID or not. And it really seemed that way too when working as a nurse within the department. I had never seen consistent days where our lobby was full of as many patients in that lobby as we had as many patients in rooms in the ER.
Wow.
And so we suddenly had to account for nearly double the population of a busy day, mind you, than what we were already accustomed for. So staffing suddenly was inadequate because we had way more patients. We also had to be really careful because if any staff got exposed or any staff actually got sick with COVID, they were out.
And you were already short.
We're already starting to see a little bit of shortness. I don't know what the right word is, but a shortage.
Yeah.
Thanks. A shortage at the end of that year. And so I just say it became frightening. Yes, because you take back the sickest of the sick patients. That's what a triage process is. And so we would fill up our rooms full of sick patients. But then we would have new sick patients who would come into the lobby. And COVID is really interesting because these people generally with the lower respiratory tract infections, so specifically the COVID that predated Delta, and then you have Delta, those two both focused on this a lot, develop lower respiratory infections, people would just slowly decline with their oxygen levels. They would be unaware of how low they actually were. So you'd have patients really that would sit in our waiting room and they would look discolored. They would seem short of breath, but you wouldn't actually know what their oxygen level was unless you went up there and put on a probe. And when you put on a probe, sometimes their oxygen levels would read as low as like 35%, 40%. It's incompatible with life. We have no idea how these people are even living. It doesn't make any sense.
Wow.
So what's normally low? Just so the audience knows.
A normal oxygen level at this altitude is 90% or above.
Okay.
And so most people will be living around 95, 96%.
What's like the lowest level you saw prior to COVID?
So like I've seen low levels prior to COVID. Like I've been in on like cardiac arrests before and other things where you do see the oxygen level go really low. But like a low level that would alert you would be anything really below like 89%.
Whoa.
And so to suddenly say, hey, these are patients who are just like coming in and they do seem short of breath, they seem discolored, and then they just sit down in a chair in your lobby, you don't realize that they could actually be really close to dying.
And they're at
They
like,
don't
you
realize
said like
it either.
35?
And
Yeah.
they're just hanging out.
And they're
Wow.
just like they're
And
hanging
there's
out, but
nothing you can really do.
they can't even talk. They could like give you one word responses. They could, you know, that they're sick, they're breathing quickly,
Wow.
they're discolored, mentally they're in a fog, and then you just like bring them back to a room, and then it's just like, okay, we got another ICU admission. We have another ICU admission.
Wow.
And pretty soon your ICUs are saying we have no more space, and that's when the ER gets backed up.
Yeah.
So that's what COVID has done, and I've seen it at that level, yes, and it truly was at that level from November, December, and January, and then just kind of declined, and then by spring it's almost as if like, hey, cool, we've overcome COVID, like we're done with this.
Yeah.
And then there was news about some other strands that were popping up in other places in the world, and they decided at that point to name them different strands. So that's like when Delta came about. The only things we really knew about Delta was that it was really contagious and that it was spreading a lot faster than the original strands of COVID. We were severely underprepared for Delta because I think most people got in their minds that like, okay, we've overcome this. Those who wanted to be vaccinated, they went and got it. Those who haven't been vaccinated, they probably got COVID anyway because there could be asymptomatic carriers.
We're fine, right?
They're fine. There's like this super unsettling area where there was really a projected balance that actually didn't exist. And so for the next several months, meaning like the end of summer through the end of this past year, it was just Groundhog Day again and again and again. You go into work and you know you're just going to constantly be working with respiratory cases, and there's no decline in them. In fact, it's just a really steady plateau. Maybe it's even going up a bit.
Wow.
Definitely an increase with Omicron, but that one has a little bit different as far as how it's manifests in the body. Not always, and it still is dangerous. I think we've gotten like way too dismissive of the fact that Omicron doesn't cause as strong of infections.
Dismissive as in the public has been more dismissive about it, or the medical field? Maybe both.
Good question. I think maybe both to an extent, but I think more the public perception of it, because I think some public health figures have also said that the infection is known to be less. And so when you have authority figures in medicine itself who are saying that it's not causing these lower respiratory infections quite like the other strands did, people do get potentially a little casual about it.
That makes sense.
I've had people tell me like, we should just all get Omicron because it's mild and we just all get the antibodies and it's herd immunity and everybody will be fine. Like we just all need to get Omicron.
Yeah.
But I think that's contributing to the casualness.
Yeah, and the thing
perception.
is that we know that it's so infectious, and when you have this many people infected with it, you're by process of just the design of the fact that you have thousands upon thousands of people who are testing a day, you're still going to have dozens of people a day who are going to meet admission into a hospital, who are still going to be sick enough to be there. Maybe ICU admissions have gone down just slightly, but I have still seen death from Omicron. I have still seen complete neglect of how serious this disease is.
It's still there.
It is absolutely still there.
Wow.
So I feel like we still hear about it, but it seems I'm hearing a lot more lately that the hospitals are just so full, so overwhelmed. Are you seeing that reflected in what you're doing right now from day to day?
So it's tricky. I think no one in healthcare was prepared 100% for what the pandemic has done to them at a personal level. But I don't want to just say it's healthcare specific. It's like any industry for that matter. None of us were prepared for how big of an impact that this was actually going to have. But for healthcare workers, it's exhausting. It's really tiring. Like I know that I'm going to go into work. I'm going to be on my feet for at least a 12-hour period, if not staying longer to wrap up my charting and to do other things. I'm likely not to get a full lunch break. I'm lucky if I could even cram down enough food to like satisfy my hunger. I'm right now at this point too, we've had so many people who just have been turned away from the constant frontline work environment that they're seeking other positions. And so we've had
like
a lot of
nurses
people
quitting.
they're not necessarily quitting, although some have. A lot of them are just looking for an easier job, so to say.
Gotcha.
One that has like standard hours, one where you don't have to work nights,
not
one
as
where you don't have to
intense.
work weekends, that you're not on the front lines and not being yelled at every day by a patient when you have to ask them a vaccination question.
I don't know why you wouldn't want to do that.
So
You're
Sounds
really
so
getting
fun.
yelled
Sunshine
at
and
by
rainbows.
patients. Just, hey, are you vaccinated?
not everyone, but yeah, they're definitely patients who,
That's
it's because like they're just waiting for that opportunity. It's like, all they've done is they fed their brain with whatever echo chamber that they've been trapped in for months. And then they come into the hospital because they're actually sick at this point. They're like, I can't wait for them to ask me this question. And you're that first
They're
person
just
because
ready
you're
to go.
triaging them, and you have to ask that question
Yeah.
because you need to know how serious you need to take the fact that they have symptoms. Because
Absolutely.
generally those who aren't vaccinated are going to be way sicker.
Wow.
And so you need to know right off the bat, are you vaccinated?
You got to know what you're dealing with. Yeah.
And then people are completely ready to unload on you. You're the
Wow.
first face that they see, and so they're not going to have any reservations with sharing their opinion.
How
and
do you
other things.
handle that situation? Because I'm sure you've learned a lot of just life lessons from dealing with crisis situations like that. What have you learned from dealing with
Yeah,
angry patients in general?
I've had many approaches to it. I remember one time this was probably like April, May 2021. And so it was at the point where vaccinations had been divided out for the public to get. And we had seen the numbers of COVID drop substantially to the point where we thought like the pandemic may be in the rearview mirror. And I remember a lady coming in, and she came in by ambulance. And she was short of breath. She had a fever and body aches. And I remember triaging her and asking her the question, are you vaccinated? And she said no. And I had the hardest time with that. I'm just like, what do you mean no? Like, having been around for the past few months, this doesn't make any sense. Like, I see people every day who are ending up in the ICU, and you're just saying, like, you're not vaccinated. You're old. You have risk factors. What are you thinking? And I remember like kind of butting heads with her, and then that went nowhere.
Yeah.
Yeah.
I'm just like, I had to tone it down because then I continued to take care of her. And I'm like, how in the world am I supposed to provide care to this person after I completely judged them harshly for not being vaccinated? And all I've wanted to do is to tell them, yeah, COVID is real, and I want you to understand that. And
You're really sick right now.
you're really sick right now, and this could have been prevented.
Yeah.
But even though you may still think that at times, it's not beneficial to your patient. It honestly isn't.
Yeah.
And so, I don't necessarily tiptoe around the questions because you have to ask them.
Of course.
And so
you need answers.
I think it's always good to go ahead and just invest a little bit of time in showing that you relate somehow to the patient. And if they're going to go ahead and share some opinion and it's opposite of how you truly feel about it, like, what's the point of taking personal offense to it? You're still going to be responsible for taking care of this person. And so just do your best. And so much of nursing is bridging gaps of understanding. It's helping to educate. It's helping to understand what somebody needs to do when they're at a health crisis. And you can't truly deliver on that if you're being really confrontational. It's the two and two can't go together.
That brings up one of the next questions I wanted to ask you. Has there been a lot more contention in the ER? Because nowadays, if you have an opinion on something, especially if it's medical related, you're going to find an answer that meets the question that you were asking, and you'll feel right 100% of the time. Just how Google works seems to be
Echo
how
chambers,
life works, right?
Yeah.
Are you seeing, you tell people, hey, this is how you save your life. And then they say, no, I don't want to do that.
Oh, yeah, for sure.
Is
That happens
that-
all the time.
But has it been more so lately?
Yeah, it has been more so lately, actually. And it's frustrating because at this point, those who are coming into the hospital are likely people who haven't been affected much by the pandemic to the point where they haven't been sick yet. Likely they're unvaccinated if they're requiring hospital admission. And so these are people who have felt so strongly at this point that they've made this specific decision and they want to fall back on their base, which is what caused them to make this decision to begin with. So they're going to become really defensive when you start talking about forms of treatment because they've done everything they can to research what their thought of correct treatment looks like. And the frustrating part is that we have medical professionals who have studied this, who have done everything they can to compare information, have it peer reviewed, and come up with a consensus of how you go about treating this. Now, for one thing, viruses are very hard to treat to begin with.
I'm sure.
Secondly, we haven't had go-to treatments for any coronavirus that have existed. And if you've ever wondered like why there's been no vaccination that's ever been present for any other coronavirus or the cold, it's because it mutates, it morphs, it changes. It's really hard to stay on top of it.
Yeah.
And so even the fact that we're like bringing this out and saying, hey, this is a way in which you can prevent serious sickness and illness. Yeah, it's true. It will be effective until it's not at some point, because it may have morphed, it may have changed, and it's really hard. So it's like you have these two things that are going together. You have just a very quick moving disease process that is actually evolving and changing. And it's really hard to stay on top of that. But then you also have information that is spreading just as quickly. Some of it's good, most of it's not. And the information that's being spread all over on these online communities and other things, they fill all sorts of ulterior motives. I think it's because people at times are distrustful of the medical community. And there's all sorts of reasons for that. It's a super complex thing. We could have an entire show on that specifically. Yeah. But
there's just a lot of fear. I feel like, especially with anything medical, people feel so vulnerable because, especially when you get sick, right? You're at your most vulnerable. Right. And so I think it's so easy to grow and engender fear surrounding anything medical.
Right. And that's the thing too. It's like fear drives all sorts of emotional decision making.
Absolutely.
And so that's really what's behind all these strong feelings and opinions that are being shared. And if you want to be comforted through this fear, then find something that conforms to those thoughts and surround yourself with it, and then show up at the hospital and say, this is what I believe in. But don't get offended if we say that's just baloney.
Like, I'm trying to help you. I'm trying to save your life.
We are trying to help
right?
you. We really are.
Yeah.
And we do have methods that are going to help. But honestly, there is no way to 100% protect you or prevent you in today's world with this pandemic at the level that it is.
Wow.
Is Joe Rogan's name ever brought up? They would say, oh, Joe Rogan told me this.
I know when Joe Rogan is clearly quoted. And there are some people who do bring up his name as well.
That's so funny to me. A comedian's name is just brought up for a pandemic. Don't get me wrong, I love Joe Rogan to death, but I just think it's funny that his name is actually,
the context is interesting.
Right
now.
I think that goes back to what you were saying of like people seek out what validates their like or what makes them feel better about their fear, and I feel like Joe Rogan brings on different types of people that can appeal to
lots of different types of people.
Yeah. He does, and yeah, that's my, like, if I'm going to say anything on Joe Rogan, it's that I'll just use him because he's the example that you brought up, but there are plenty other media sources that do this exact thing.
Sure.
And that is that he paints the image that he's the everyday man. Therefore, you can relate to him. And because you can relate to him as he talks, you're going to like it because you're going to feel comforted by just the language that he's using. He's going to ask questions that most people will ask as well. Mm-hmm. He's going to invite guests who are going to bring in a perspective that might be enough to capture your attention and have you question things. And though I don't think that there's any harm in questioning what we have that may go against the grain per se, when we have mass education as a result from what you're saying is a comedian, or in other words, an entertainer, somebody who has previously appealed to television, mass media, who now brings that to podcasting. Prior to that was an MMA fighter. Like, this person knows how to get ratings. This person is going to do anything he can to sustain a show that has continued to grow and to be downloaded all across the world. When we place our value in that, which is popularity, and it's popular opinion that is educating us, and it's not the standard education, which is like actually going into an environment where you exchange ideas, you listen to one another, compare thoughts, and it is designed to be boring in some ways and not just entertaining. You can potentially learn things that can challenge the status quo a little bit more effectively than I think what happens with Joe Rogan, which is actually a toxic culture that comes in as these patients request things because they heard some expert anecdotally talk about something on one of his shows. And now they're trying to pressure somebody who is specifically focused on a piece of their training that they have spent their entire career focusing on.
That puts you in a hard position.
And it puts us in a really hard position because we have to do what's medically sound. We have to do what's medically correct. We have to do what's studied. We have to do what the community endorses.
Yeah.
And if you don't do those things, are you going to cause harm to your patient? Or are you going to put your own license at risk? And I don't think there are many practitioners who are willing to do that.
Wow.
I think, long story short, we do love Joe Rogan. We're going to get some crazy comments from this. But maybe don't place all of your values on him, right?
Yeah.
He shouldn't necessarily be anybody's Bible.
Yeah.
Right? That you live by.
Nor should anything, like any one source, be
That's a great
your
point.
only place for information.
Right.
That's a great point.
Right. And honestly, I'm only saying this because you brought his name up specifically. And I, again, it's like, I'm just saying, maybe it's seeming like a scapegoat in my opinion here, but the same thing could be said, I feel of it's just.
Same goes with any source, right?
Same thing goes with any source.
He's not the only one that has millions of followers.
Yeah. Yeah, I mean, like anything that you see that has such high popularity, I think is at risk of educating the masses, and it forms a huge groupthink. That's the thing that I would be cautious of.
Interesting. Just for our viewers, do you want to explain what groupthink is a little bit?
Sure. So it's a conformity to a specific way of thinking that because one person might put it really well, and they endorse it, and you see it work for that one person, it then can be picked up by the community at large, and so everyone adopts it and believes the same thing.
Yeah, it's definitely something we've seen a lot during this pandemic. As we're coming close to wrapping up, what would you say has been some of the major things that you've learned working as a nurse through the pandemic?
What's the value that you've grabbed from it?
Yeah, honestly, no amount of training I think could have really prepared you for this. And so the training is ongoing. Right now, we are doing everything that we can just to scrounge together to pull enough staff day in and day out. And what that looks like currently is that we have literally nurses who are still in nursing school who have been hired to like an apprenticeship, and we're training them on the spot because we need them. And so what I've learned through this is that be patient with people who are trying to learn the ropes of what it's like to be a nurse, because these are the people who are going to be treating patients tomorrow. And so I've certainly learned a lot through just going through my own educational process of learning how to deal with stress, how to deal with making medical decisions, having independent thinking, and those type of things.
I have a follow-up question because, me being on the student end of that, where you're knee-deep in nursing school and you have clinicals and whatever, and it's hard to find the motivation to do all the school and all of that. When then you're hearing these stories of we're understaffed and it's just hard. How do you find the motivation now being in the field? And this applies to more than just the healthcare field, but what motivates you to keep going? What's your why of
how do you get out of bed?
Yeah.
Why do you keep doing it? Why are you still in the ER
I don't know.
even despite all of this?
Oh no. Buckle up,
I wanted
friends.
to answer that honestly.
Yeah.
I'm just curious, how you keep going.
It is fulfilling, and honestly is. I think things that are challenging generally are fulfilling when you give it your all. And so I'm continuing to try to give it my all. It's exhausting. But what I like is the fact that there are people who are still interested in joining this career. And they're looking to, even through the pandemic, looking to make that career shift and jump into something that I find really exciting. And honestly, no one day is the same. There's always differences. Even though I said it's like Groundhog Day at one point, you will still see other things that are not COVID.
Yeah.
And even things that are COVID can be different from one another. And sometimes can be exciting. Yeah. But the thing that I find motivational, at least, is just the fact that truly it is an occupation where you are helping people. And I think more so than even helping your patients, you're realizing that you're discovering so much about yourself. So much is going to be revealed about your own personal biases, about your own way of formulating thought and in acting upon that thought and creating independence and other things comes about through nursing. And I find that really exciting.
Yeah.
Last question I have to ask it. Based on how the medical fields and how people handled the pandemic so far, does it make you hopeful or not hopeful if there's a worse pandemic, one that actually is?
That's a good question.
I would say COVID is scary. I'm not going to dilute that in any way. But if there really is another pandemic that comes along that people are terrified to get,
Ebola or something like that.
Yeah. Does it make you hopeful or not hopeful?
It's hard. It's honestly, is the glass half empty or is it full type of question? Because I think we're at pandemic fatigue right now. Like, we don't want any more of this. And as evidenced by the fact that right now our hospital numbers are at the highest level they've ever been. And we're supposedly
2 years deep.
right now, 2 years deep.
January 31st, 2022.
Yeah, and we're supposedly with something that is much less of a threat than the previous strands. And so it's like, we're trying to brush this under the rug and we're just not talking about it anymore. And all these precautions have been loosened because we realize all the other impact that closing things down has. And not just the health consequences, not just the financial consequences, like just the general well-being of people.
Yeah.
And so,
life.
Life. And so people are just like done with it. What I'm fearful with that mentality is that if there is a new strain that appears that is actually like way worse than any of the previous strains, or if there's a new virus or a new bacteria or I don't know, a new spore that somehow like crops up somewhere on the earth and just seems to spread as quickly as COVID did, we still have that pandemic fatigue. You know, if it's something like Ebola, I think that like people truly would be afraid because they would see people.
I would be afraid.
Die. Like, one out of every two people would die.
Wow.
And so, we have history to go off of though too. It's like this has happened before. Like look at the bubonic plague back in Europe. You know, look at the Spanish flu pandemic.
Yeah.
Look at COVID right now. So it's like we're just, who knows when the next one will hit? But we live in a global community. And we certainly realized that with COVID, this was the one that really spread all across the world. But we had close calls before. We really did. We've had close calls within the past like 10, 20 years.
Wow.
And so, I think it could very likely happen again. Will we be prepared for it? I don't know.
Yeah.
Time will tell.
I know.
On that note.
That's crazy.
Society will be tested, I guess.
Yeah.
This has already been a test.
Yeah, absolutely.
The last 2 years of like how we'll manage in the healthcare system as just people trying to live our life. Like, what do we do in a time of crisis?
Mm-hmm.
Do we hide or do we like kick into that fight or flight like all the healthcare workers have had to do of like, okay, well, this is just what's been thrown at us. And so we're going to take it and run because what other choices do we have? Like, I feel like that's a lesson that applies into life as well. Of life throws whatever, whenever, and there's no real way to expect it ever. And it's what do we as people do? Like, how do we continue to, like...
How do we respond?
Yeah, how do we respond and how do we not let it completely derail us?
Totally.
Like, how are we still functioning human beings that have things that mean things to us and, like, keep our families and keep our jobs and, like, keep going when we're faced with the unknown?
Yeah, exactly. Yeah, totally. I mean, if there's one thing that we've learned through COVID, I think it's just this great accelerator. Just made everything that we knew was going to happen that much faster. It's like we're going to transition to online learning, most likely. We're going to transition to working from home, most likely. We're going to transition to, ordering food and having it brought to your house that much more quickly. Yeah. And the collapse of the U.S. healthcare system and the world healthcare system too may happen. Well, we'll see. Like, COVID may be the thing, like, because it's already been such a hot political mess for years and years and years. And we know that change has had to be brought about. And
now there's a spotlight on it.
Now there's a spotlight on it. So we'll see what happens.
You said we knew there had to be change. Has the change been positive or negative?
Probably both.
It's both. Yeah. It totally depends. Like, if you're working in an occupation that, hasn't seen such high demand throughout the time that COVID has existed, like, it kind of sucks for you.
Yeah.
Because now you're at this spot where you're just questioning, like, can I continue to go on in today's world? But, if you were like, what companies have done extremely well through COVID? Like there's been
Zoom.
Yeah. Okay. Yeah. Here's like, Zoom stock, of course. Like,
they've done great.
Yeah.
Totally. Well, I feel like something that I took away from this conversation that I wasn't necessarily expecting was just that everyone's struggling. Like we're all just trying to do our best. And I think sometimes we look at the medical community, we look at our healthcare workers as, they have the answers, they can help us. And even though, or either that or they're the scapegoat, right? Like let's blame them for everything. We kind of hold them at a different position than I feel like everyday people. But I think something that we can learn from this pandemic is just that we're all people, we're all trying our hardest. And I think it makes having compassion and understanding that much more important. And I love how you touched on, when dealing with maybe difficult patients, how you try and find something to connect with them with. And I think that connection that if we intentionally seek to have with individuals, that's something that can powerfully remove the fear that is so prevalent in our society today. And so for me, that's the lesson that I think I want to take from this conversation, is just to seek for more connection with everyone.
Yeah, well said.
I mean, just piggybacking off that, something that was super valuable in this conversation for me is just there's a human side to everything.
Yeah.
I listen to so many podcasts at work. Love podcasts. Every single channel I listen to always brings up COVID in one way or another. And sometimes it really feels like the healthcare workers have to somehow play God and have to be this perfect thing. But there is 100% a human side to everything going on in the medical community. And that's something I definitely want to be more looking out for and more understanding of, for sure.
Yeah, just that compassion, right? Everywhere. We need it.
Yeah.
So
I think that wrapped it up really nicely. Thank you, Steve, for
definitely
coming on.
Yeah, thank you.
Yeah,
thank you
shined
so
a lot of
much.
light. No, it was great. You shined a lot of light that I think will be valuable for obviously us and hopefully everybody watching. So
Sweet.
All right.
Links
Thanks,
in the
guys.
description to everything.
yeah.
And we appreciate you watching.
Thanks.
Bye.
See ya.